Okay, looks like we are recording, so welcome. It's July 10th, 2024, and we are here for the Interstate Commission for EMS Personnel Practice. And it's our regular scheduled executive committee meeting. So I will go ahead and call it to order. And I know that Commissioner House said that he had some travels today and he might be in and out, and he serves as our secretary. So I believe I can do roll call for a smaller meeting at least. And I will note that Commissioner Kinney, myself, is here. Commissioner Denny, I believe, is on.
I am on. Yes, here.
Thank you. Commissioner House. Commissioner Vandeloon. Commissioner Taylor.
He also noted a conflict, sir.
Okay.
Yeah.
I am present.
Thank you. Appreciate that, Aaron. And Commissioner Schmieder.
I am here. Thank you.
Thank you all for being on here. So we do have an agenda that was distributed and then a went out to the committee members as well. We will start with matters not on the agenda. Well, actually, first of all, the game rules. Committee members are encouraged to join by camera when requested. That'd be the executive committee. Other commissioners may do so if they elect to. Public attendance is encouraged. I see we have several public members. Thank you for joining our meeting today. We appreciate your interest in participating. Microphones for all attendees are muted upon arrival. Please, if you have a question or a comment, please use the raise hand feature at the top of bar there, right in the middle. There's a raise hand. If you click that, then I will recognize you, and then you will have the opportunity to unmute your mic and speak. We will limit comments to 2 minutes or less for general comments. From the public, I always take comments from the exec committee first, and then I'll open it up to any commissioner and then to the public as well. In case of background noise, disruptive behavior, or comments exceeding the 2 minutes, then our executive director is authorized to mute as well. So with the business out of the way, the first agenda item that we have, I guess the first was roll call. The second one would be public comments, matters not on the agenda. Does anyone present have any matters that were not on the agenda you would like to bring before the executive committee? If so, please use the raise hand feature. Seeing no additional comments, I am going to alter the agenda slightly due to a time constraint. And we are going to hear, and it's actually listed as new business, Jim's opportunity, and I'm going to recognize our executive director, Donnie Woodyard, who will do the preface. Donnie?
Yeah, thank you so much, Mr. Chair. So as the EMS Compact continues to grow, one of the things that we've recognized is the need to increase both public education and public awareness, and also a mechanism to better educate the 400,000 EMS personnel that are part of the EMS Compact. Honestly, we recognize that I encounter people nearly every day who have a valid privilege to practice, but they either don't understand the privilege to practice, their employer doesn't understand the privilege to practice. So in that vein, we've been looking at opportunities to increase both awareness, education, and public education. And I'm delighted to introduce Dr. Ted Lee, who is the editor-in-chief of GEMS. Dr. Lee reached out a number of months ago, actually, wondering if there's a way that we could do a collaboration to address our need to increase public education. And so Dr. Lee has prepared some documents that I can look at and the executive committee can review. But I wanted to invite Dr. Lee here to provide really an overview of GEMS and perhaps the opportunity to meet our goals with this. So with that, I'd like to turn this over to Dr. Ted Lee with GEMS.
Thank you, everyone. A lot of familiar faces and familiar names on the list. We've crossed paths. I've been editor-in-chief now for about a year and a half, and as GEMS is kind of rebranding and going through some new opportunities. As Donnie had mentioned, I reached out, and we are looking to expand. We have a voice, we have a following. And it is my belief and the belief of the group now as we are moving towards the future to use that voice for all things pre-hospital medicine, and EMS Compact is one of the big driving issues that we believe we could help with. As Donnie mentioned, we do have quite a few examples of some partnership paperwork that you guys can review offline. These are living documents and can be adjusted to whatever best suits your mission and how we might be able to work together. But through article, webinar, podcast, our social media, GEMS at FDIC is our event. Yearly in Indianapolis every April. We are growing that event. For 2024, we had 13,500 EMS credentialed providers at an event that had 65,000 people. So I'm sorry, 36,000 people. So we are growing quite a bit, and we think that we can help, and that's what we would like to do. So I'm open to any initial questions, and then of course we are open to further conversations about any formalized partnership.
Mr. Chair, if I may.
Go ahead.
Yeah, Dr. Lee, thank you for that. I did want to just state for transparency's sake that in our conversations with GEMS, we did note that as a governmental body, we want to make sure that any partnerships we do are aligned with our transparency, and that's why we invited Dr. Lee here, and really do appreciate the opportunity to really consider how we could leverage articles, webinars, podcasts, Con Ed modules, etc., to better the exposure and reach to the EMS community. So, Mr. Chair, back to you.
Thank you. And thank you, Ted, for being on here. With Indianapolis hosting FDIC and GEMS, then I am used to working with him. And I know they very much, since I've been working the past several years, very much want to reach that EMS audience. And I think it was always great to look at ways to integrate EMS into both the conference, but also to the actual literature as well. And so I think this is an opportunity. I'm open to questions or comments from the other executive committee or commissioners or public, if you want to use the raise hand feature. Yes, Commissioner Schmieder.
Hey, good afternoon, sir. Thank you for your interest. I think this is a good partnership that we help get the word out. The compact, I'm the state EMS director in Texas, and the compact got us through COVID with some of our bigger services, or bring people in from other states and move people around pretty quickly. So your interest, I think, can benefit our cause, but it could also benefit the total EMS system in our country. So thank you for your interest.
Yes, of course. And, longtime provider, I agree. This is an opportunity definitely that we have. And we see us as, a potential, partner in the voice of making sure that, the people that we have are our viewers and followers, that we get, credible information out to them that they might not know about.
And I agree with Commissioner Schmieder. Thank you. And I think that's a good opportunity. Other questions or comments? I will suggest, and then I'm open, I know I can direct it, but I will do it as my proposal, that I would direct that Donnie and I work with Ted before the next executive committee and report back sort of an informal work group. If there are other executive committee or other commissioners that are on that have a particular interest in this, then certainly we could include you in any discussions we have as well. From the executive committee, does that seem like a reasonable approach? Any concerns there with that, Donnie?
No concerns at all, sir. I will note from a workload perspective, we looked at this initially about 6 or 7 months ago. Dr. Lee reached out and the timing just wasn't correct. I believe the timing is correct now. And I'm happy to help lead a lot of the content creation. But I think for a richer product, the one thing I would note is I think we would make richer content, richer, more meaningful materials if we had other commissioners and stakeholders that would participate in the development of these materials. So I will note, I'm happy to do a big lift of this, but I do think it will be some involvement with some of the others, and we can work out those details.
Absolutely agree. Thank you. Commissioner Schmieder.
And Donnie, if there's anything I can do along the way, just reach out. I think this is a great partnership, and I think we have a great story to tell.
Thank you. Okay, thank you for being on, Ted. We appreciate that opportunity. Donnie and I at least will be reaching out, and then we'll be reporting back. And of course, you're welcome at future executive committee meetings if you would like to participate as well.
That's great. Thank you very much for your time, everyone. It was nice seeing everybody. Looking forward to working with you.
Thank you. The next agenda item that we have is old business. And the first one we have is we had an administrative rule change. I will turn over to Donnie for an update on that.
Yeah, thank you so much, Mr. Chair. This is just to formalize in the meeting minutes that the administrative rules that were adopted in June by the full commission have been updated in our official records and on the website. So that action item is complete. The official formalized rules are both active and available for download and reference.
Thank you. Appreciate that. And we also have our continuing work group on EMS workforce privacy protection. Will that be you or Commissioner Johnson? I saw he was on.
No, I think that one will be me, and then Commissioner Johnson will be on the Code of Conduct.
Okay.
So the regular monthly meeting of the data, my apologies for that. That should have said data protection. So that's an error on the agenda on my side. The data protection work group had a regular meeting scheduled for yesterday. Due to some guest speaker conflicts and changes that happened, that meeting was postponed. It will resume in August, most likely with a guest speaker from our federal partners that will discuss data protection. Again, my apologies for the update on the agenda there. That should have said data protection.
Thank you. Any questions or comments on that update? Treasurer's report. Are you presenting that, Donnie?
I will present that, sir. So for our treasurer's report, we had a beginning balance in June of $98,321. We had an ending balance of $84,218. We had our standard deductions for the month, and the report is submitted. It's in the packet as well.
Thank you. Noted on the report. Any questions? Okay, next up we have the May 2024 Executive Committee Summary. Sorry, we had some communication errors there, and that was something that was submitted late. I know I reviewed it, as did Donnie. We believe that is accurate, and it's on your screen now. Any corrections or motion to approve that summary for posting?
Motion to approve?
Thank you, Commissioner Denny. Is there a second to approve the meeting summary?
I'll second.
Okay, thank you, Commissioner Kaler. We have motion and a second. Any further discussion, comment, otherwise? All those in favor of approving the summary and posting it, please indicate by saying aye.
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 Any opposed? Nay. And any abstentions? Okay, you are authorized to post that. Thank you. Next up will be the chair's report. I don't have a long one this month. Donnie will have I get lots of updates, lots of great communications with Donnie. We have a lot of good things going on, but he's usually the most versed to indicate with you what's going on. I do want to address one matter. Donnie is working with the National Registry of EMTs. We have an agreement we renew, and we have engaged Doug with that as well. We're just starting the process. Our current agreement goes through the end of this year. So we're getting started early enough, but Donnie is our point person on that. But that any agreement that comes out of that would come back for our consideration. With that, I will call on Commissioner Schmieder for any updates from bylaws and rules.
Nothing to report. We ended up, it became a meeting conflict and we did not meet. So I would just say we may want to talk about at a future meeting. Do we just not have meetings in July and August? I mean, it just seems like it just between vacations and everything else going on, it may not be, just take the summer off, you know, like everyone else does. But other than that, sir, I have nothing else.
Thank you. Still appreciate the work, and it's good that we got that rule updated on data. The Executive Director's report, over to Donnie.
Again, thank you, Mr. Chair. So from a high-level overview, continue to work with a number of states. I do want to call out Oklahoma in particular. Oklahoma has recently hired 3 additional personnel that will be in leadership roles in the EMS branch. That may not be the correct terminology there, but been working with the current Oklahoma commissioner, and there will be a transition plan put in place there. So I'm very happy about that. Oklahoma has also developed an FAQ that is related to the EMS compact for EMS agencies. And they're working on making a couple of updates to the FAQ, but I think this is a really wonderful document that they are distributing from the state health department to all EMS agencies on state health department letterhead that really addresses questions about the EMS compact and clarifies that EMS agencies in Oklahoma can utilize EMS compact personnel. There is no process to request a state licensure. And it really makes sure that EMS agencies in Oklahoma have access to all EMS compact personnel. Ultimately, it does continue to reinforce that it's the agency that has the choice of whether or not to hire or utilize compact personnel, but there are no other barriers. So I just want to applaud Oklahoma for that. I think it's a great step forward. And once that document's finalized and redistributed, I'll make sure the EC has a copy of that. The other thing I just want to bring up is in the meeting document. I'm going to scroll down here a little bit, and I want to say thank you for some feedback I received. So the version on the screen is formatted slightly different than the version in the draft book. But I provided an overview of occupational licensure compacts in the United States. Currently in the United States, there are 17 occupational licensure compacts. Most of these are health related. It does include a massage therapy compact and a cosmetology compact, but most of these are health related compacts. And there's been an absolute surge in compacts. And there is no question that occupational interstate compacts are the gold standard now for multi-state licensure of professional occupations. And so in this document, and I'll resubmit this version to everyone, but it provides a simple overview of the occupational compacts in the United States with a brief one-sentence summary of them. Here is a map that shows states by their participation in occupational licensure compacts. And you see the majority of states are participating and have many compacts. Some states are part of 10 or more of these compacts. And then if I scroll down just a little bit more, you have the list in the EMS compact, no surprise there. But this table, and this is slightly reformatted from the draft version, but this really shows the different occupational compacts and the states. I did a subset of states not part of the EMS compact, but are part of some of these other compacts. And so, for instance, you can see states like Arizona. They're part of many of these compacts here. Arkansas, many of the compacts. Kentucky, Maine, Maryland, Montana, New Hampshire, North Carolina, and Ohio, for instance, are part of many of these compacts. And so it just provides us an insight into where EMS is compared with other occupations. And I think it's very important to note that we want to ensure that our EMS colleagues are not disadvantaged or disenfranchised in these states. These are states that have fully embraced interstate licensure compacts. And we believe it's important that EMS professionals have the same opportunities as our colleagues in nursing, physicians, psychology, and physician assistants, physical therapy. So I provide this as a means of education and awareness for the commission here. And you can read that. So with that being said, I continue to work with our federal partners and our state partners on a regular basis. I will be attending the United States Fire Administration Summit in October. Was able to finalize that today. I will also be attending my standard quarterly meeting in Monterey at the Postgraduate Naval School coming up here in a couple months. So that will be coming up. I did request states to reach out to me for any regional or state conferences that they want my presence at. And a final note is in September, I will be presenting at the EMS World Conference. So with that being said, I'm happy to take any questions, but that's a high-level overview from the Executive Director.
Thank you, Donnie. We appreciate your hard work on it. I really was intrigued, and Donnie and I had good discussion on his summary of occupational licensure. It's always been interesting, but to be able to map it out, I appreciate his work on that. And then he and I discussed that we may see a little bit of an evolution, and two of us may be looking at target states, that indicate, hey, they have their state legislatures have a willingness to adopt compacts. Why is the EMS compact not advancing there? And Donnie's the one to push for that, but I agree 100%. And I think it's an area of opportunity and growth now that we've kind of made sure organizationally we're in good shape and prepared to answer questions and provide guidance on how the privileged practice works and what membership in the compact means. Open to any questions or comments from the Executive Committee first, and commissioners or public, and you can raise your hand if you have any question. It doesn't have to be on the compacts. It can be on any of Donnie's reporting. Okay, thank you, Donnie. We appreciate that. We are now ready for the National EMS Database update and go to Ray Mollers.
Thank you, Mr. Chair. I don't really have anything to call out on this month's report. We continue to work with states to try and get them onboarded. I guess Tennessee and Nebraska could be the next two, and I think I said those same words last month. But barring any questions from anyone, the report will stand as submitted.
Any questions for Ray on that? Okay, thank you for your help on the database and your report. Commissioner Kaler.
Yeah, I do have a question, maybe not specifically for Ray, but I just, and as it relates to the National Registry, I just had a quick question about with their switch to the new examinations, our state rules still require that a psychomotor examination to be administered for folks to be licensed in our state. Will that affect us in any way, I guess, in terms of the compact?
No, and just those materials are available on the National Registry website behind the login. As a state official, you can get to those. So no, I don't see any effect to the compact itself. It's really state licensure requirements is what it affects. Gaining your national registry would be, you could gain that, and then, it's an intermediary step where it has to get their psychomotor before they get licensed.
Right. Okay. Thank you.
You're welcome.
Thank you. Any other questions? Okay, we will move on to new business. We already covered the GEMS opportunity, and so I will go back to our Executive Director for Provider Bridge presentation.
Yeah, thank you so much. So it's my joy to introduce Ann Lawler. She is with the Federation of State Medical Boards, and Ann reached out a few months ago, and she can provide an overview of this. But the Federation of State Medical Boards has been working on a project to help implement digital credentialing and digital validation of licenses across multiple professions. And this is a project that has federal roots going back to the COVID pandemic. So she reached out, provided an overview of it, and after hearing the overview, invited her to present the same overview or similar overview to the executive committee. So, Ann, thank you so much for joining today. If you need screen sharing ability, I think you have the ability to do that. If not, I'm happy to help.
Okay, thank you so much. And thank you to all of you for having me today. Can you hear me okay?
Yes.
Okay, I think if it's okay that I share my screen, I have a PowerPoint that sort of explains this to you. I think it gives you some visuals instead of me just talking. So let me get that going here. I'll share the screen and put this into slideshow mode. There we go. Nope, except I don't want that. Oh man, I hate that. I don't want the notes side. How do I get rid of that?
Up at the top.
Thank you.
There you go.
It only does that when I present in front of people I don't know. Okay, so just a little background about me. Wayne Denny and I know each other. I used to be the executive director for the Idaho State Board of Medicine. And now I'm working for the Federation of State Medical Boards on this project. And my background's been very helpful on this. So what Provider Bridge does is it provides a database platform for verifying medical credentials for emergencies, disasters, public health crises, things like that. So it's free to use. It is up to the minute, we call it. We'd like to say real time. I mean, with the API connections, I'll explain in a minute. It's not exactly real time, but close. It is nationwide. And so the background of this is we developed it during COVID at a time when a lot of providers were flooding into other states to help, which was wonderful. Unfortunately, a lot of the states didn't have the bandwidth to be able to verify their credentials quickly for them to come in and help. And there were some situations where people didn't have the credentials they said they did. And so Federation was given a HRSA grant to develop this platform, which they did back in 2021. And by then, a lot of the states had sort of sorted how to manage the influx of the physicians, nurses, and PAs and other medical providers coming into the states. So now it hasn't really done much over the last few years. And then about a year ago, we were added to a license portability HRSA grant to expand the platform to use not just for a pandemic, but also for any disasters, emergencies, public health needs, even just for underserved areas. And so we've been updating it, and we're under a new grant as of July 1. And part of the new grant is for us to add more professions to the platform. We currently have physicians, PAs, and nurses. And so EMS obviously is a perfect candidate for a profession to add to this platform. And so why is this needed? As I'm sure you know more than most people, that we've got a lot of disasters happening in the US, the wildfires, the hurricanes, just so much. And then on top of that, we have so many people in the US that are in medically underserved areas. They're isolated. They're even underserved areas right in the middle of New York City. So we definitely need qualified medical providers to help in all of these situations. And Provider Bridge can at least help sort of connect the dots with people and make sure that the entities that need the help can find the providers they need and make sure that their credentials match. We have a video here. I won't play it right now for you, but I'll give you guys the link so that you can view it at your leisure. But the video is really tailored for the providers themselves. But as I'll explain, Provider Bridge is not only just for providers to register into, but it's also for entities to use it. Oops, there we go. So we work with these entities at this point. So we work with NCCPA to verify the credentials of the PAs. The Federation has all the license information for MDs, DOs, and PAs, but that we need to know that the PAs are accredited. We also connect directly into the NCSBN database for the nurse data on their licenses, and also ABMS to show the specialties of the physicians. And so the passports that are generated when someone registers into Provider Bridge have the information, their name, their licenses, what states they're licensed in, whether they have discipline. If it's a physician, it'll show their specialty, their NPI numbers, their DEA numbers, and even where they went to school. So it's not full credentials, but it's sort of, I call it a dating app. It's sort of that, the introduction, it sort of clears the person initially to say, yes, they're valid, they have a good license, they're not under discipline. The technology we use is cloud hosted, so it's not a database that anyone has to maintain somewhere. It's just online. That gives it full portability. It's also accessible from anywhere, and it's secure. And so we're not creating a new database. We're just kind of connecting to the information that's already out there. We use API programming, the application programming interface, which I had to read that because I'm not a computer programmer and I don't remember those terms. And so it gives a rapid certification of existing licensure and specialty board information for immediate use. And then I'll talk about the certificate-based documents that we have. This is a scary diagram that shows sort of the ins and outs, the inputs. So on the left, you have a provider, they register, it takes a few minutes to register. They can then pull their passport at that moment and they can actually present it at an emergency disaster site, whatever it might be. And the report they're pulling is an Adobe verified trusted document. Federation has that clearance with Adobe to do that. And it shows that the document is tamper-proof and that the information in the document is true. On the right side is the entities. And so an entity could be a hospital, it could be an emergency management team in a state, it could be a public health department, it could be FEMA, it could be a variety of groups. It's also free for the entities to register and to use the platform. It takes a few minutes for them to register, and then the Federation vets them to make sure that they're not using the platform for a purpose that it's not intended. For example, it's not just intended for standard staffing. We don't want one entity to steal providers from another, things like that. But it is truly, as long as it's in the spirit of emergency, public health needs, things like that. The entity can go in and upload a roster. So if it's a hospital, they can upload a roster of their providers, or they can search current registrants who are in there. And then they can also pull data reports, and they have a dashboard function. And that is all of these things are secure logins so that people can't get in there and do anything that would not be appropriate. As I mentioned, the providers, they register or opt into the platform, and that just says they're willing to serve. It's not an obligation in any way. It takes a few minutes and they get that Adobe Trusted Passport. This is just what the current website looks like. We're actually right now in the process of redoing the website. So it's going to look a little different than this. It's actually, I think, much nicer looking. This was created back in COVID and we're just finalizing that. So it should be out in the next month. And so a professional would click on the top box. And if we were to add EMS, this would be where they'd select their profession. And then they go ahead and fill out the registration. And then the entities would go in the lower box. This would be an example of the initial create your login. So an EMS provider would create their login here. Then it says, okay, create your profile. So then they just have, this is a physician. I'm just giving you that example since we don't have EMS in here yet. A physician just fills out this information on this screen and this information on this screen. So it's super fast. And actually they only need either their NPI, their license, or their DEA number. I think for the EMS, it'd be more like a license number, or it could be, I believe Donnie said that you have a unique identifier in your compact that, we could use that as well as an identifier to cross-reference that provider to make sure that their license is valid. This is an example, a very old example, but this is an example of a passport of a physician. It shows where they went to school, when they graduated. It shows their specialty certification. As you can see, it says no actions reported. If there were actions reported, it would look, I'll show you in a minute what that would look like. And then it shows their active licenses and the DEA numbers. This would be an example of one where there is board action. So it's very obvious if someone presents this, or if you're an entity and you pull it and you see the big red stop sign. And then on the second page, I don't have that example here, but the second page shows what state the action is in, and then you can contact that state for further information, because anything that would be reported here would be public information. We are working on wallet functionality. So this is my nurse passport actually in Provider Bridge. So this is an example of what a wallet could look like. You would scan the QR code and it would take you to their actual passport. And then we talked about the entities a little bit. So they would register to access the system, and then they can search providers. They can search right now by state, by obviously profession of the 3 that are in there. They can search by specialty. And so that way, if a particular state is looking for help, like an example I use is the director of the Oklahoma Medical Board is very interested in this, because often they'll get a tornado, and what ends up happening is it's a very regional, unlike a hurricane or earthquake, but the tornadoes are very regional, and the providers in that area are pretty much knocked out for helping anybody because they're in the middle of the tornado as well. But you can get help from not too far away, and sometimes that might be over the border. So this platform being nationwide, they could go in and search, okay, we need emergency docs, we need EMS providers, we need nurses, whatever. And then you can search by location and make sure that if they need a license in that state, you can search by license, and that way you can pull it that way. This, again, that would be just where they'd go to register as an entity. The entity has the same sort of login. Then they create their registration. And then again, it's not a lot of information. It's just really this page and then this page. Actually, it's not even that. It's just this page. And there's the account creator. So, the entity would want somebody who's going to maintain that. Then you have a dashboard. This is a search. This is an example of a search that you can do. And then this is a dashboard. Once you've uploaded your roster, you can look at the dashboard and you can see there's a little, the gavel there if they have an action. And then this would be like an example of a provider list once you've uploaded or either you've searched for and added to your roster, or you've uploaded your own. This is the search, and we're working on expanding the search to have more fields. And so that's underway right now. And then that is our website. So that is the program. And so what our ask is that we are interested in adding EMS to this. And now, knowing that unlike nurses, for example, or NCSBN, where they have a national database of all the nurses, EMS is a little different. And we're having that same issue like with psychology and some of these other professions that we would like to add to the platform. And so one way that we are starting is to talk with the compacts, because the compacts typically have a database of those licensees And so what we need in every case is a place to go verify the license against that database. And so with the compacts, there's often a database there that we can verify against. So with EMS, I wanted to start with you all because it would be a way that we could do that technologically. And so I think Donnie, I don't know if you want to add anything, and then I can open it to questions.
Yeah, thanks, Ann. I think we identified that there are some technology challenges, and there's some implementation things. So we recognize there are some things that we'll need to discuss, but I thought at this junction it was really good to invite her to at least brief the EC. And this is again in the same alignment of my overview before, and that is we want to make sure that EMS as medical professionals have access to same or similar resources as our other medical professional colleagues. And we want to make sure EMS is not disenfranchised or left out in any way. So in the spirit of that, if this is something that the EC would like us to explore more, I'm happy to work obviously offline and between meetings to identify, is this possible? How would it be possible? What would it require? Are there financial impacts, et cetera? But this is that high level overview of what's going on with other professions.
I'm a huge fan of it. I think it's a great idea.
Mr. Cedar.
Yes, and I think this is the whole purpose for the compact. I guess I'm a little confused on what the ask is. Is the ask that you just want to be able to get into our database and see what we have, or are you asking for a link from our database to your database?
So the ask is really just if you're interested in pursuing the idea of having EMS added to Provider Bridge, then what we would do is Donnie and I would work together to get our technology teams together to talk about how it could work mechanically. It's typically when you work with compacts, I know because I was on the Interstate Medical Licensure Compact from day one. And so the compacts always have to vet these sort of decisions. And so we wanted to see if there's an interest in this, and then if so, then we will proceed forward with more exploration to see if we can even make it work technologically, and then see what the steps would be, because there would be development on your end and at our end. And so we have to figure that out, and there could be some financial impact there. We do have some of the HRSA grant money that we've gotten for the next 5 years is to help us support the technology development to do this. And then there could be some possible grant money for your organization as well, to if there's some technology developed that meant that would have to be done on your end.
So just so I want to fully understand what you just said. So you really are looking to link to our database.
Correct.
Okay. And I'll just be honest right up front. I think that's where the challenge will be, because the 77,000 people in Texas that are in the compact are under the belief we're not linking to anyone else other than to the National Registry through that database. So I don't know how we get around that. On giving you access to look at it, I'm not overly concerned about that, but giving you access to the database could be is I think the bigger challenge here. And I'm not saying no, don't do it. I'm just saying I think that's what we're going to have to work through.
Could I answer that?
Oh yeah, go ahead.
No, I just wanted to answer that really quickly. So I think part of what is, it's not a full access to your database. What it would be is a simple API call to pull only for the person who is registering into the system at that time. So in effect, that licensee has already said, I'm approving this connection so that you can pull my license data from the compact. It's not that we would be scouring your whole database of all your EMS providers, only those who register into Provider Bridge, giving in effect permission for us to do that.
Good. Thank you. That helped quite a bit.
Yep.
Commissioner Denny.
You can tell Ann and I have shared space in legislative committees before, because that's exactly what I was going to bring up. So yeah, I don't have anything further.
Thanks, Wayne.
other comments or questions? Okay. What is the will of the executive committee? Do we want to form a group to look into feasibility of this, or just authorize Donnie to continue looking at it? What do we want to do?
I think we should pursue it, whether it's having a work group to look at it or just proceed. But I've also got an interest in this because the preparedness programs in my bureau. And I'm already sending emails off to them that they need to take a look at this and what have you, because this is wildly important when we start talking about disasters and verifying credentials and what have you. And I know even during COVID, we could have used this for EMS providers, and we can use it now with the limited recognition that we do for EMS providers during wildland fire. This would be very, very, very helpful. So I'm all for it. If we need to do a work group, that's fine. I'd be happy to participate, or however we want to get there.
Any other thoughts? Okay, for today, thank you for presenting, Ian. And I think this is an opportunity where we probably can work together. And I think we do want to be cognizant. I think you addressed Commissioner Schmieders, but we need to be cognizant of that as well, to make sure everyone is on board. I will, unless there's an objection, I'm going to take it under advisement. And if there is any commissioners besides Commissioner Denny that are interested, reach out to me, and then I will issue whether I assign that to Donnie or form the work group, which I'm authorized to do. So commissioners, if you have interest in this, please reach out to Donnie and I, and we will formulate a game plan there, and then we'll reach out to you and then on further discussions on it. So
That sounds great. I really appreciate your time today, and thank you so much for your support.
no problem.
All right.
Thank you. Okay. Appreciate that. And we are now up to the draft position paper privileged practice. Donnie, is that you, or is Commissioner Johnson going to present on that?
If Commissioner Johnson is willing, I'd like to defer to him. He did a tremendous job leading that work group.
Thank you.
Thank you, Donnie. I was going to defer to you, but I'll take a stab at it. I had a great team working on this position paper. We used what Donnie had sent us at the beginning, and a couple of other states' code of conduct policies they had. We kind of molded it all together. We think we've got a complete list of everything that we're looking for in the code of conduct for the persons that have privilege to practice. I've always said, we need to come up with something that keeps or puts the professional in the profession, and we hope this is it. We left it in draft format for the executive committee or the whole commission to adopt or put into policy, however they need to do it. We wanted to leave it short and to the point, so that's why we left it in the bullet format. To be easy to read, easy to follow, and not a lot of fluff to muddy the waters. The only debate we had, and again, we wanted to leave this to the full commission or the executive committee to undertake, was the language in there for EMS practitioner versus EMS clinician. I know there's some debate in other areas of like National Registry or things like that. And we felt like we weren't in the position to make that change. So we just left it as EMS practitioner and leave it up to the whole commission or the executive committee to adopt whatever language they wanted to adopt across not only this document, but other documents as well.
Thank you. Anything you would like to add to that, Donnie?
Yes, sir, Mr. Chair. So I think the question is, okay, what could the next steps look like? So there are probably a few paths, and I'll do my best to explain what those paths could be. So understanding the legislative authority of the compact, it is specifically limited to that of the privilege to practice. And so one option would be for the compact commissioners to adopt this as the code of conduct for EMS practitioners exercising the privilege to practice. And that is very much within the legislative authority of the commission. And so that could go through the process of either adopting this initially as a position paper, and then we work with the bylaws and rules committee to determine an administrative rule process for this. So that could be one option. Then the next mechanism would be then to see if we wanted to perhaps encourage compact member states to work on a modified form of this that would be a uniform code of conduct recommended by the compact for those states. And then a final, if you would, another expansion of this would be to work with NASIMSO and other professional colleagues on what could this look like as a national code of conduct. As a way of level setting, just for this group and those on the call, we've recognized that our profession does not have an adopted code of conduct that is uniformly accepted. So the commission is first seeking to adopt one within our legislative purview, but then we hope to work with partners to see if we could have one that would be more broadly adopted. So with that, I think the action steps could be to, one, determine if the EC wants to put this out to the full commission for consideration as a position, refer it to the Administrative Rule Committee for possible inclusion as administrative rule, and then after that, how could we engage the broader EMS professional community?
Okay, thank you. So I think we have a couple of things. One, and I will say on the issue of the language of practitioner, I'm not beholden as to practitioners, clinicians, professionals. I've heard all different terms. I was inclined to say, and then I was rereading it, I was inclined to say maybe define it, in the actual position paper. But I feel like it is kind of defined in the second paragraph. Would be up a little bit, Donnie, there. And it says, if it's hard to read on your screen, the EMS Compact is comprised of individually licensed EMS practitioners with a privilege to practice in multiple member states, creating need for a unified code of conduct that is adopted and implemented by all states and jurisdictions licensing EMS personnel. So I believe you're kind of defining practitioner by listing them as individually licensed in the member states. So I think that's kind of covered, but I'm open to discussion on that. I do feel like it should be considered by the full commission. I believe that's what we've done with other position papers. I think it is ripe for consideration as a position paper to kind of challenge the states. I think it could be sent to rules and bylaws to see if there is any room for consideration as a rule or bylaw within the commission as well. But I am open to thoughts. Those are my Commissioner Schmieder.
And I'll never fail you. I always have a comment, I promise. I agree with everything you said, sir. I think my desire would be once the full commission, if they adopted this, then we would look at it as, should we embed it within rules and make it permanent at that time? I'm not sure doing it at the same time and one side or the other fails, then we spend a lot of time on it. And the only thing, and I read over this right before this call again, the third bullet point where it talks about treating all patients with respect and it goes on from there. Would you consider an edit to that to say treat all patient and each other? Because some of the challenges I've seen in my career is that if I don't like you, then I treat you bad, and it could be based off of race, religion, or any of that kind of stuff. And it's not adjusting that line, add another line saying something very similar to that, something for consideration. But I like this, and I think if we do this here, we could set the stage for the whole nation.
And I will say, thank you, Commissioner Streeter. I think that is a good point. And I think we are patient focused, but I struggle a little bit without something for our coworkers, other responder groups, and I would say even members of the public, which would include family members, because I think sometimes those are the complaints we see in Indiana. And so that might be something worth discussing. Did you consider that at all, Commissioner Johnson?
We did, and we felt like it might have been covered enough in bullet point 7, where it says work cooperatively with other healthcare professionals in the best interest of our patients and act in a responsible and professional manner that does not discredit or dishonor other healthcare practitioners. You bring up a valid point, though, about the public. I don't think we addressed how do we deal with the public and bystanders and family members.
And I agree with what you said, number 7. I think what we would add, my recommendation would add into that to go on, regardless of the race, creed, color, age, gender, build that right in there, because I think it's the powerful part of that document.
What if it said treat, instead of in bullet point 3, it says treat all patients, it says treat everyone?
Well, and that's what I said, that I was thinking in the beginning, treat all patients and each other, or something like that, and I'm not hung up on what the exact words would be. I'm just to get that message out. So thank you for even considering it.
Want to hear, and then I'll have a suggestion. I want to hear if there's any other comments, questions, or otherwise relating to either the document, the position paper itself, or how to proceed. That can be from anyone if you use the raise hand feature. And this may take a little bit of calculation, Donnie. I should know, I should memorize all my bylaws and such. But I believe, given that our next meeting's not till October 8th, when would we have to publish this for consideration? If it's position paper, it doesn't have the same thing as rules and bylaws, right?
Right. We just need to make sure it's on the agenda.
So we would have
30
time, which is my question for Donnie and Commissioner Johnson, whether it'd be worthwhile for the committee to kind of take some of these ideas and work it through. When I heard everyone, I kind of like that. However, that also encompasses almost off-duty conduct when you word it that way, treat everyone. Then, and maybe we want to do that, but, to me, that I know for our EMS, usually it's on-duty conduct, unless it's criminal in nature. So I wonder about having the work group take a look at that and see if maybe there's any room to clarify.
We'll be happy to look at it at the work group level, or however, Donnie and y'all think it needs to be looked at.
So we will look at that. Oh, Commissioner, go ahead, Donnie. Sorry.
I was just going to say, happy to, Commissioner Johnson, work with you to reconvene one more working session on this, and we can then create the draft. Maybe what I would request is from this group, because I don't want to run out of time for EC meetings. So after we do that, then I could circulate this to all commissioners, perhaps, or perhaps even circulate it to all commissioners and invite them to one more working group session. Maybe that's the way to do it.
Yeah, that
From my
sounds good.
perspective, from my perspective, I think that seems logical. So then they aren't blindsided. They at least know something is coming up. And I think it'll be interesting to feel the pulse from them as to, is this the state position paper that kind of challenges the state offices to look at it? Or is it an issue where, our own rules and bylaws can look to see if we have our own set that could potentially impact privilege to practice somewhere? Okay, any further comments or anything on? We will show this tabled and we will reconsider that. Partner organization updates. I saw Dia had to hop off, said she did not have anything of urgency from NASIMSO. I know we have a board meeting Thursday and I was looking and a few things down the pipeline, but nothing major to announce. I know Donnie and I were talking earlier. We do have the fall regional meetings for NASIMSO, and so there may be opportunity to include Donnie in some of those because we're looking at bringing them into the Great Lakes so that Indiana's not the only state in my NASIMSO region and try to bring in some more people. So any other organizations that would like to give a quick update, please use the raise hand feature and I'll be glad to call on you to do so. Okay, Donnie, anything further before we wrap up?
No, thank you. Nothing at all from me, sir.
Okay, I think we're at the adjournment. We do have future executive committee dates. You're invited to attend. They are at the bottom of the agenda, August 8th and September 4th. We have scheduled meetings of this executive committee. We have our next full commission meeting date is October 9th, and that one will be elections, and that is a virtual electronic meeting as well. So those are the upcoming events. So thank you everyone for being on. I appreciate the executive committee. I appreciate council being on. Appreciate Donnie as always being on, and then also the fellow commissioners as well as the member of public that have an interest in the compact. Thank you for participating. Have a great day.
I see Wayne put his hand up.
Uh-oh. I think he was saying goodbye.
Saying bye.
I think he was waving, I hope. Thank you, everyone.